That's fine. All right, seeing that it is 3 p.m., I will call the Health and Human Services Committee meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Moving on to public comment. We have nobody in person and nobody online for public comments. We will go on to item number 4, approval of the November 1st, 2023 Health and Human Services Committee meeting minutes. Do I have a motion? Motion by Crosby, second by Arstead. Welcome, Dennis. Are there any comments, additions, corrections? All right, seeing none. All those in favor say aye. Aye. Opposed? All right, none opposed. Meeting minutes pass. On to item 5, policy issues, discussion, and potential committee determination. 5A, consideration of the opioid settlement fund deployment recommendations from the Criminal Justice Coordinating Council. And we have Judge O'Neill, who chairs that council, here today. Welcome.
Good afternoon, everybody. Thanks for having me. Is this on? Okay. So I appreciate the invitation here, and I appreciate the opportunity really for the CJCC to look at this particular issue. As you know, the county board was looking for a recommendation as to how to allocate and spend the anticipated opioid litigation settlement funds. And so the CJCC was fortunate enough to be able to partner with the Marathon County Health Department to engage in a results-based accountability framework discussion. The CJCC, I'm not the best leader necessarily at those committee meetings, and so we really needed a structured format to engage in that to get the best results. And we really are focused on trying to identify evidence-based programs that could most impact positively our community. So with the help of the health department, we started meeting back in March of 2023 to go through that structured discussion. I think we had about 6 meetings. We met every month through August. And through those discussions, we were able to identify a number of at-risk groups in our community that we really wanted to try to help. Drug-endangered children was one group that we discussed. Moving on to addicted parents of young children, considering at-risk teens and peer pressure, trying to avoid them making some of those mistakes that are going to be lifelong. Moving on to incarcerated persons, as well as those with dual diagnoses in our community, suffering from mental health as well as addiction. And then we discussed some of the programs that we do have available in Marathon County that are already being funded, as well as kind of our hopes and dreams of what we would love to be able to do if we had all the money in the world. And what we realized through those discussions was that we do have several programs in the community. I think that we've been relatively proactive for our size of community in addressing addiction, but we need help identifying those gaps. Where is it that we have funding and maybe we don't need more, but where is it that we really need to focus our attention? So the group ultimately, after having met several times, in the end are now recommending that the money initially be spent on a consultant to perform a gap analysis to really identify where the needs are in our community so that we have the best really bang for our buck to try and impact positively the most at-risk needy members of our community. So after a lot of discussion, and each of our meetings was 1.5 hours to 2 hours, we really tried really hard to try and define the best way to allocate that money. But in the end, we really felt that the best use would be to conduct the gap analysis to really determine and identify and define the areas where we should be spending our money.
Madam Chair, if I'll take a little bit as well.
Yep.
And thank you, Judge O'Neill. She's very humble. She's a very good leader of our CJCC. I just want to fill in a little bit. We did this presentation at Public Safety a while ago, but I think it's also really important to come here and walk you through like Judge O'Neill alluded to, we utilize the results-based accountability framework through the health department. And I want to just talk a little bit about kind of how that process started. And I'll really set some context with the opioid settlement dollars. And this is all in your packet, so I'm not going to belabor the point here, but Marathon County did join in the opioid litigation against distributors, and the structure of that settlement, to this point, we've received about $700,000, and the remaining balance that were total projected balance is to be in excess of $2 million. That comes in over 18 years, however. So it's really the idea that when the board entrusted the CJCC to kind of take a look at this and figure out how to look at utilizing these funds, to Judge O'Neill's point, we really did spend a lot of time and were diligent about it and tried to identify kind of a return on investment sort of approach in light of the current investments that Marathon County has made throughout the continuum of care we offer in the justice system and our human services system. So what is results-based accountability and how did it work here? You'll see in the packet we have a list of our CJCC participants. The group is large and mighty. It is made up of people from across our, not only the government elected body side, we had Chair Van Cray as well as Chair Boots of Public Safety would participate. Chair Gibbs is the vice chair of the CJCC, and Judge O'Neill leads that. But we had representatives from throughout our criminal justice system, our Department of Corrections, state partners, local law enforcement, and community members. So we came together over the schedule that Judge O'Neill talked about, and we really started with what is the result that we're aiming for. And in kind of in line with what Judge O'Neill said, we really saw there's a lot of impacts from opioid substance addiction. And we came up with the results statement being Marathon County residents are free from the physical, emotional, social, and economic impacts of opioid misuse. So a very laudable, large goal, right? We wanted to pursue that result, but how would we measure if we're having any impact? And we really focused on identifying a couple of measures. First, that already existed. We didn't want to expend a lot of resources trying to find a new data measure when there was likely a couple of good data measures already in existence, and there were. And we settled on opioid overdoses, and really in two respects. The first is the number of suspected overdoses. So we're getting that information through our health systems and through ambulance run reports. So those are individuals that have overdosed but don't necessarily perish, which is a good data measure for us because it's capturing a segment of the population that perhaps the justice system really isn't going to come in contact with. So you'll see we have that data system, or that data point, that's something that's tracked through Marathon County Pulse. The second data system are the drug overdose deaths, and that's something that we've talked a lot about at the county, in the justice system for a long time, also at the county board. Jess and her team in the medical examiner's office keep that data. So those are 2 points that we really thought we would see some movement if we start having an impact toward that result. We then talked about how would we do that? What is going to be what levers are we going to pull? And Judge O'Neill and the health department walked us through a process of identifying, what are those driving factors that would make the most difference? And that is somewhat constrained because this is these dollars came from a settlement. So it's not unusual that the funds that flow from that settlement are not to be used for anything and everything we would want. It's, we'd all love to live in the world where, like Judge O'Neill said, we had all the money to do everything we wanted. It's not all the money, and there are some guardrails on what you can use the funds for. And there's actually an attachment to this report that is in your packet that lays out what those limitations are, generally speaking. So through that process, we did come to the realization of, okay, we identified these factors and strategies. We wanted to have SMART goals, and we wanted to rank things. Not every intervention is created equal. And as Judge O'Neill said, we we went through that process, and in fact, we utilized this room and had the wall up with, we had the wall covered, I should say, with sticky paper and various colored dots to rank the various areas, and we had very lively discussion. And at the end of the day, we identified those things that in the CJCC's mind were the highest kind of return on investment or highest ranked programs or approaches, the medium and then low. But even the low, high, medium, and low, all were valuable. It's not like anything we put on that list the group didn't think was valuable. But the highest rank right now for us was that number one was conducting that GAPS assessment, of our continuum of care for treatment and recovery in the county. And then the second one is expanding our Sheriff's Office deflection program and the Wausau Police Department's program, the PARI program, to route low-level offenders to treatment. The reason there's an asterisk there is we already have funding for that. The CJCC didn't think it made logical sense to deploy more of the funds toward that program at this point, those programs, I should say, because we really need to get some baseline data and experience with respect to the deflection program. The DA's office just hired their new deflection person. She started a couple weeks ago. Dana, she's great. She's going to do a great job. But we really need to see, with the funding we have and the approach we're going to take, what is going to be the impact. So that leaves kind of in that high category, that gaps analysis of our continuum of care to see, where are those areas where strategic investments could be important. And I won't go through all the medium and low, but they're all everything in there is a need. I'll pick one: expanding stable, sober housing in Marathon County. That is a need. The fact that it's in medium doesn't mean it's not important or isn't valuable to invest in. But when the group went through and we had our discussion, that top billing really went to conducting that gap analysis. So I should say with the gap analysis, Laura reached out to colleagues kind of in that space. And my understanding is SAMHSA, the Substance Abuse Mental Health Services Administration, has people that will do that. And we estimated, our estimated cost right now is about $50,000 to do that. But we're happy to answer any questions you might have about the process. At the end of the day, we made very clear with the CJCC that group was entrusted to bring forward recommendations. At the end of the day, the county board is vested with how do you deploy those funds. And again, you're getting those funds over a period of 18 years. You do have a rather substantial initial outlay that's come in, but I think being very deliberate like the group was is a sound strategy. So with that, I don't have anything else. I don't know if you have anything, Judge O'Neill or Laura, to walk us through, but we're happy to answer questions. It's agendized. If you wanted to take action today, I asked the chair to agendize in that way, but by no means do you need to. This is something that it would be a budget amendment, whether it happens this year or next year. We didn't deploy any funds from the settlement as part of the 2024 budget that I proposed or that the county board adopted. So this isn't anything that you need to make a decision today, but we wanted to get in front of this group as well as public safety and then help you make your determination relative to next steps.
Thank you, Lance. Did public safety make any decisions?
They actually meet next week.
Okay.
They had the initial kind of overview of this, but we didn't have the information back on what the cost was of that initial gap analysis. So they knew they were going to have another presentation, so we didn't belabor the presentation.
Okay, and then if it was decided that one of the committees wanted to move forward to the county board, does that have to go through finance first?
I'll have to think about that. The funding source would be identified. So it's not as though finance would have to identify a funding source, which is normally something that finance, if a other standing committee wants to do something, they normally make a recommendation to finance to figure out where the money would come from. Here, the money is delineated for these purposes. And I should show you in the presentation the attachment. This Exhibit E, that is not our Exhibit E. That is Exhibit E from the settlement itself, so it talks about the list of available uses. So I don't necessarily think it would be something that needs to go to HR Finance and Property. I see Mike is down there. I don't know if he's got a different opinion.
He's shaking his head. Okay, so then with that, are there questions? Go ahead, Supervisor Krause.
Yes, I'd like to ask if you, for our listening audience, if you could read some of those high, if you could read the high, the medium, and the low. Thank you.
Yeah, happy to do that. So the high, number one, I already referenced, that's the gaps analysis assessment of our continuum of care for treatment and recovery in Marathon County. Number two, which I also referenced, is the expansion of Marathon County Sheriff's Office Deflection Program and the Wausau Police Department Police Assisted Addiction Recovery Initiative, referred to as PARI, to route low-level drug offenders to treatment instead of the criminal justice system. And that's the one that I referenced that already has funding available to it. The medium category, we identified number 3, which was expand medication-assisted treatment, MAT, in the Marathon County Jail by creating a full-time case manager to oversee the program. And again, the Sheriff's Office is working and has received some funding to do that. Number 4, provide stable, sober housing in Marathon County. Number 5, expand the number of MAT providers in Marathon County by providing fellowships for addiction counselors, offering scholarships and support for workers in MAT, and providing funding and training for clinicians to obtain waiver under the Federal Drug Addiction Treatment Act. Number 6, explore a co-responder model like CART, or a chaplain program that pairs a law enforcement officer with a therapist to address OUD and SUD-related calls, and that's opioid use disorder and substance use disorder-related calls. And number 7, in that medium category, is support early intervention programs for at-risk students in Marathon County school districts. In that third category, the low category, number 8 was support and expand peer recovery coaching in Marathon County, and number 9 was explore a countywide naloxone plus strategy, which works to ensure that individuals who have received naloxone to reverse the effects of an overdose are then linked to treatment programs or other appropriate services.
All right, are there any other questions for Lance and Judge O'Neill or anyone else that was involved? Yeah, go ahead.
So thank you, Judge O'Neill, for this is and all the people that worked on this. I think it's a great comprehensive report for the direction that we need to go. And I think that this is an important subject for the residents of Marathon County. So I fully support, everything that's been done with this, and I'm looking forward to seeing it go forward. So thank you.
Yeah, and to piggyback off of that, I really want to thank the health department. Their facilitators are incredible, and they did a really great job, keeping us on track and making sure we were going the directions that we needed to go. So it was incredible to see them work and come up with these results from it. So if there aren't any other questions or comments, then what's on the table is, where do we move from here? Is the committee interested in making any formal motion, or a consensus that public safety will take a look at it and make a determination from there? Yeah, go ahead.
So with the gap analysis, if we move forward, is that when we would start looking for someone to take that job description?
What I would foresee us doing is actually putting out a request for proposals to get someone to do that. We actually have started, we've done a number of these over the last several years. North Central started one about 4+ years ago and was about halfway through it when the pandemic started, and then that it stopped, and I think you need to start again if you were going to utilize that. We did one also in 2018 with the start of the strategic plan. I had Joan from the health department. She led an effort to kind of do I don't know if I want to call it a gaps analysis, but kind of where we are and where some of the gaps were, but it was more internal facing than having someone who truly has expertise in that area. But there are people that do that. SAMHSA, again, the Substance Abuse Mental Health Services Administration, has people that will do that analysis for you. The work that we were doing with North Central a number of years ago, they had a consultant. It wasn't through SAMHSA, but I wouldn't envision us creating a position. We would find someone with the skill set to do the assessment through a request for proposal and select that vendor.
So do we need to move forward before we get that going?
To do that, what I would envision, and Mike and I can talk about specifically how to do that, but a resolution amending the budget to move funds from the current location where I think they're just sitting in the general fund, but I can look into that, to move those into an operating account for purposes of conducting this work would require a resolution, and because it's moving money, it's a budget amendment, would require a 2/3 majority, but that would be the next step. If you want additional information, we're happy to get it, or convene a joint meeting of public safety and in this body, or certainly you could make a motion to have those funds, $50,000 up to $50,000 allocated for that purpose. You also could pick any of the other things. This again was the CJCC looking through the available uses in light of our training and experience in our professional work, identifying the areas where we thought strategic investments would be valuable. But at the end of the day, the board is, as long as it's something that's permitted by the settlement itself, you're in charge of how to deploy those funds.
So I'm hesitant, I mean, the committee can make a determination. I am hesitant, though, to go ahead and make that motion without public safety taking a look at this first. So that's why I asked if there seems to be consensus that we're in support of that. I think it can just be noted that there's consensus of support. And then either public safety can make the determination, or we could have a joint meeting if this body wished. Go ahead.
Thank you, Madam Chair. Yeah, and I agree with you. I think, and that was going to be my statement as well. So I think that, we'll have them take a look at this before we make a decision.
Okay. Go ahead, Supervisor Krause.
Thank you, Chair. I was wondering, who would be determining which of those items that you mentioned in high, medium, and low, where that 50,000 that's allocated, that future allocation, who's going to determine on which one of those areas it would be used?
Well, I apologize if I was unclear. The 50,000 would be for the gap analysis, to have someone come in, look at our continuum of care, probably spend a lot of time, quite honestly, with North Central Healthcare and our other local providers of mental health and substance abuse treatment, and see where our gaps are, particularly for our justice system involved population, and produce a report with some recommendations. So that's where the 50,000 that I was referring to, that's the estimated cost for that gap analysis. We'd put out the RFP. If it came back more than 50,000, then we'd have a different conversation. But the other items on that list, or any of the other items in that settlement document, the Schedule E, where it talks about what the available uses are, the county board can say, hey, these are the things we want to accomplish. We want you to develop a plan, staff develop a plan to expand, just going to pick number 5 because it's at the top of the screen, expand the number of MAT providers in Marathon County by providing fellowships for addiction counselors, offering scholarships and support for workers in MAT, and providing funding and training for clinicians to obtain waiver under the Federal Drug Addiction Treatment Act. If you called for us to develop a plan and you want to spend $100,000 doing it, we can come up with the plan, present you the plan, and you can allocate the funding to it. You can do that with any of the things on this list or anything else. Again, the CJCC just did the front end work of looking through all of those things, sitting down in little groups and having discussions before we had them with the larger group, and then rank ordered them. That's what led to those 9 that are on the screen.
All right, so do we want to have a joint meeting with public safety once they've heard this information? Or are we comfortable with allowing public safety to move forward with a recommendation to the board? Does anyone have comments?
I'm okay with allowing them to move forward with it
Okay.
if needed.
Okay, so it seems like the consensus, go ahead Supervisor Krause.
I think it would be good for them to look at it, but because we're the Health and Human Services Committee, I think we should have the final say in it. Not the Public Safety Committee, but the Health and Human Services Committee.
Okay. I guess I would disagree that we should have just the final say, but if you're concerned about our voice being heard, then I do think that a joint meeting between the two would be appropriate. So if we could once, at some point in the future, after January, if we can find a time to have a joint meeting, then that would be appropriate, so both committees can have a voice at the table. All right. If that ends discussion on that item, then we will move on to item 6, operational functions required by statute, ordinance, resolution, or policy. 6A, the Lead Safe Homes Grant. Laura.
Okay, so on page 30 of your packet, there is a link to our white paper that we wanted to include. This grant is available to the health department. The total of the grant is $15,600. The grantee, of course, is the Marathon County Health Department, and the grantor would be the State of Wisconsin Department of Health Services. Just to give you a quick overview, the Marathon County Health Department follows DHS 254 on all lead mitigation testing and activities. And in cases where a child has a blood lead level over the state level, which is over 5 micrograms per deciliter, or in their blood or higher, we as the health department are required to conduct a lead investigation and work with the families or property owners on lead intervention and abatement. And just to give you a sense of the health repercussions of lead, lead is a health hazard. There is no safe level of lead in your blood. So for children, it's especially dangerous. Even low levels of lead in the blood have been shown to affect learning, IQ, a child's ability to pay attention, academic achievement, and long-term and actually do long-term harm. Exposure to lead can seriously harm a child's health and cause well-documented adverse effects, including damage to the brain and nervous system, slowed growth and development, learning and behavior problems, and hearing and speech problems. So the Lead Safe Home program is housed within the Bureau of Environmental and Occupational Health of the Division of Public Health at the Wisconsin Department of Health Services, and it's funded by a health services initiative through the Children's Health Insurance Program, CHIPS, at the Center for Medicare and Medicaid Services, and it has matching state grant funds. The grant supports and enhances the health department's required lead intervention and abatement activities. So the Lead Safe Home programs, it will create safe and healthy home environments free of lead hazards for families in Wisconsin, in Marathon County specifically. The program focuses on homes built before 1978 because the year 1978, which also happens to be my birth year. And people always say, homes that were made in 1978 or before are dangerous for lead. And someone told me it's because the homes are really, really old. And I was like, well, that's rude. That year is burned into my brain. So we really want to focus on homes that were built before 1978, families with children under 19, and pregnant women eligible for Medicaid or CHIPS. And so those are really our priority areas. Generally, we get information when a child does test high for lead. We go in, we take sanitarians and public health nurses to assist the family with identifying where the hazard is and how to mitigate that issue. So the projects that we're proposing through the grant would be, again, enhancing our already required lead intervention and abatement services. They're listed on the white paper. Generally, it's about helping those with elevated blood levels, reducing lead hazards within the homes, and focusing on those populations that we discussed. So the total number of projects we would do with this is 5. And then we would also do training and certification. And then there would be some related activities for actual costs incurred, which would be about application enrollment, referral fee for the property owner, risk assessment and clearance investigation, project completion fee. So we would be reimbursed for cooperation with the lead hazard reduction companies during the lead hazard reduction work if that was required. And then we would do also some workforce development related. So this grant is currently available to us, and what we're seeking is that we need to do a budget amendment, I believe, in order to accept these funds. So I think that this, and Mike, tell me if this is correct, we would look to this committee to move it forward to the Health and Human Service, or not Health, HR and Finance. Is that right?
Just to clarify, have we already been approved for the grant? Okay, then yes, you are correct.
So even though we don't have a resolution before us today, it would just be a motion to move forward to HR Finance? Okay. Okay. Are there any questions for Laura about the grant? Go ahead, Supervisor Covelli.
Thank you, Madam Chair. So in the document, it says that you follow DHS 254 on all lead mitigation testing and activities. Can you explain what those are?
Sure. Dale, would you want to take that one on?
The lead mitigation or abatement activities include things like talking with the homeowner about the steps they need to take in order to protect their household on a short-term basis, but also working with contractors to develop a plan. Things like siding replacement, window replacement, front porches. Windows and porches tend to be the highest. Then we have things like the soil. Within the drip edge, or where the edge of the roof drips water, that old homes have been flaking off and dusting off lead paint for years and years. And that soil where Junior or Juniette makes mud cakes and drives their little toys and tractors, that has it in there. And fingers are always going in the mouth. So we work with them to develop a plan for that. It's not an inexpensive project, and the work by DHS is to help provide funding to help resolve those lead hazards in our community. There are a lot of homes out there.
So some mitigation work is simple, like we can help the family put duct tape on the windowsills, or help them with vacuuming and things of that, like help them understand what they need to do in order to mitigate. Some mitigation is more substantial, and those activities, like we wouldn't repaint a house, we wouldn't do the lead mitigation within, like if there was lead paint on the walls, but we would connect the family with resources that would be able to do those things.
Yeah, and the city of Wausau, for example, has their own funding to help with those types of mitigation efforts then.
Okay, yeah, that was my question is, if you have a low income family that has to do some mitigation and improvements, and they can't afford to do that, where do they come up with the funding, I guess?
Yeah, we work closely with the city's community development department, and they have homeowner and rental rehab funds that they can put towards those properties.
Okay. Are there any, is there any funding available for the county residents outside of the city if they have to do this?
The state has some lead funding that they can utilize for those sorts of things. There's not a lot, though, unfortunately. There's an organization out of Juneau County Community Development Block Grant Program that we will steer people to that can help.
Thank you. And I know it's an important subject, and it's been going on for a long time. And I know that, the houses that I've purchased and sold and have to go through some type of mitigation as well and inspections like that. And I do know it gets expensive. So my concern is with the low income folks that can't afford to do it, are there, funding opportunities out there that either low interest rate or grants that they can do that with?
I'm happy you bring that up because it is a concern for us as well. This is a issue for that primarily, it disproportionately impacts individuals that are living in poverty. And so we want to make sure that we're providing them with resources and education and options because the worst possible situation is we have a lead poisoned child that is not getting the resources they need in order to, get better.
Can I? Perfect segue, great question. So later on in your agenda is the Community Development Block Grant Program. So we're in a consortium, Marathon County is in a consortium with a number of other counties. It's operated out of Juneau County, as Dale referenced. And if you go to their website, the Juneau County Housing Authority, it is for non-entitlement areas, to your point about outside of the metro area of Wausau, which the term is escaping me, but it's an entitlement area for community block grant dollars, essentially. The Juneau County Consortium operates for the rest of the county, and they have a specific area on their website where they provide what are the available programs, and they have on that website Protect Your Family from Lead brochure to kind of address some of these same issues. And as Laura said, a lot of this, a significant number of these individuals that are impacted may be renters. So the community development block grant dollars also can be accessed for rental units.
Go ahead, Supervisor Arstead.
Thank you, Madam Chair. So how do they determine the lead in the blood? Is this something that that they always check for every time they go in for their checkups?
Well, ideally, if things are working correctly, pediatricians should be doing a screening for kids, and they will ask parents, "Do you live in a house that was built before 1978?" So if all goes well, and that screening form triggers then a blood test. So they don't want to do it on every single child because there isn't a cost to that, and especially with individuals that are living in poverty, having an additional medical cost is not necessarily the thing you want to do. However, if it's going well and it triggers that blood test, and there's more than 5 micrograms per deciliter in their blood, then we would become notified, as it is mandatory reporting.
Supervisor Krause.
Thank you, Chair. Being low income and on Section 8 HUD housing, I was in a home that was quite old, and 85% of the outside of the house had peeling leaded paint. And it was a couple of years, maybe 2, 3, 4 years I was there, and nothing was done. I didn't know it was being brought up to the landlord. But Community Development Housing said that I'd have to move if the landlord did not remedy or replace the house siding. So he was a carpenter, and he and his father replaced the entire siding on the house. And then where I'm living now, the garage had peeling leaded paint, and they had to have, I don't know if you call it a hazmat or whatever kind of unit out that would wear all of this protective gear around their heads so they wouldn't be breathing in the lead. But they repainted. I think they scraped and then they repainted. So I wish there would be some kind of a preventive measure so that these little ones wouldn't be getting all this lead in their blood. If there was some kind of a program or some way where they could look at the housing that was built, way before 1978, that they could go in and check things, inspect things, and then remedy that situation before these little kids get this problem.
I'm so glad you bring that up because we are actually looking to work with the Hmong American Association, and H2N is applying for a grant in order to proactively go into homes and test and meet with families that are that have homes that were built before 1978. So it's not super, it's not the, in the public health sense, it's more of a secondary prevention strategy rather than a primary prevention strategy. The primary prevention strategy is really no more lead paint. And thankfully we don't, it's not being used anymore. Lead paint, again, was discontinued supposedly in 1978. And so that's the primary prevention strategy. The secondary is to do more screening. So that is what we're focusing on right now.
Thank you.
All right, are there any other comments or questions? All right, seeing none, we are looking for a motion to refer this to the HR Finance Committee for determination, and this will also be going to the Board of Health to next week for their meeting, and then it would go to HR Finance. Right, Supervisor Arstead with the motion? Okay, second by Supervisor Gonnering. Any other further comments? All those in favor? Aye. Aye. Opposed? Right, none opposed. Thank you. Item 6B, the Cooperation Agreement for Community Development Block Grant Program, which we have just learned about.
And Mike can take you through why we're being asked to sign the resolution. The county is being asked to review the resolution. I just wanted to pull up, in light of the question, it was perfect foreshadowing. We really put a lot of effort into putting those items right next to each other. Sometimes better lucky than good. But here's the Juneau County Housing Authority website, the Community Development Block Grant dollars, and I just wanted to show you on that website, there is that Protect Your Family from Lead brochure right on the link. So it helps individuals that could access those funds to make application to the Community Development Block Grant. But with that said, Mike can walk you through the resolution that is in your packet.
Sounds good. Thank you, Mr. Administrator. I actually, before the meeting started, Googled the Community Development Block Grant because I am not the subject matter expert in this area, but I wanted to be able to answer basic questions. So I'm actually really glad that came up in the previous presentation, so I didn't have to answer those questions. Thank you. The resolution that's before you at this point is basically a reconsideration or a re-upping of the existing agreement that we have relative to the Community Development Block Grant. We're currently a member of a consortium of multiple counties regarding implementation of Community Development Block Grant dollars. That consortium has Juneau County as the lead county for purposes of handling application process and distribution, and we're a member of that. That agreement is a 2-year agreement that expires, and what this resolution would do is continue that agreement for the next 2 years and also allow that agreement to automatically renew until we determine that we no longer want to be a part of that consortium. So that's the purpose of the resolution, is twofold. One, to re-up our membership, and two, to continue our membership until we determine that we don't want to be members anymore. And all of the things that were just said about the Community Development Block Grant, I would echo and add to this without any further comment because I wouldn't know what I'm talking about.
Thank you, Mike. Are there any questions about this agreement? Right? No questions, no comments, and do we have a motion?
I'll make a motion to adopt the resolution.
All right, motion by Covelli, is there a second? Second by Supervisor Krause. All those in favor, say aye. Aye.
Aye.
Opposed? All right, none opposed, thank you.
Can I make one comment, Madam Chair?
Yes, you can.
I think this is an area where, there's a lot of individuals that don't know about this program. They don't know it exists. A previous supervisor, Supervisor Harris, was very active in this area. He was our representative on the Community Development Block Grant through that authority that Mike referenced. I would assume that a number of your constituents, this might be an area where, now that you're aware of the program, it might be a valuable resource for them, because as Health Officer Scuderi referenced, there's a lot of people that probably don't know this exists. But it can be not only for a homeowner, but an individual that rents as well. So I think we're out of brochures right now here in our little brochure stacking area, but I'll get some more. And if at any point you think we can be of assistance, let us know. But it is a very, very valuable program for individuals that have a lot of various challenges with respect to housing.
Anybody outside of the city of Wausau, since city of Wausau has their own block grant funding to use for these purposes. All right, item 7 then I think we're on, educational presentations and committee discussion. 7A, update regarding recent meeting with local state legislators regarding nursing home supplemental payments and other state funding. Gary?
All right, thank you. This committee had asked us to set up a meeting with the legislature members that represent Marathon County to talk about the nursing home funding. So we set that up. Lance and I met with them along with Vicki Tilka and Jason Hake. And that happened, and Kurt was there also. So that happened in November, and we had a fairly good turnout. We met at North Central Healthcare. Senator Felkowski was there, Senator Tomczyk was there, and we had Representative Schneider, Representative Callahan, and Representative Rosar. Did I say that correctly? She's from the southern part of Marathon County. So we had a very good turnout. We used it as a time to educate them on exactly what North Central Healthcare did, because in the area we are kind of renowned because, especially being a tri-county, the largest entity handling community programs. So we went over all of that with them. Had an opportunity to discuss each of our community programs that are offered by North Central, and then focus primarily on the nursing home. So when we got to that point, we talked about the nursing home and the loss of funding, and went through how that impacted both Marathon and Lincoln County. You know, they explained in it that that was one of the major, Representative Callahan brought it up because he was on the board at the time. He is not now, he's since moved, but he was on the Lincoln County board. Talked about how that loss of funding was one of the things that has really moved them to sell the nursing home. And so it was a big deal. They had mentioned that Senator Felkowski and Representative Callahan had brought forth a budget amendment to reinstate those funds, but it didn't get traction, unfortunately. They were really surprised that with 16 counties dealing with the same thing, that there weren't more counties that came forward. And I've found that too, as I've contacted the counties and sent the resolution. It's kind of floored me that we've been the leaders in this and everyone else has just sat back and they haven't wanted to do more, but yet they're crying about how it hurt their nursing homes. So in the end, what it boiled down to was that they had tried. There's not going to be another time that they're going to try to bring it forward, unfortunately. And their best time to do it was when they had all the excess funds that they now don't have. And they pretty much said the theme of it was we increased your shared revenue. So it was, but it really felt like, you know, we tried to explain that didn't help when it came to the nursing homes. We did our best to sell that. They were impressed with North Central. I did do a tour for them and took them around. They were impressed with what we had. We talked about other funding too while we had the opportunity, because when you have them in the room, you talk about other funding like APS and how that's just not enough to deal with the issues that we have with adult protective services. We talked about crisis, because crisis is a huge need. You just went through some stuff there with the opioid when you're talking about CART and that's all part of that. And we talked about some of the funding that we're getting for our youth, the youth hospital and youth crisis stabilization, because we're getting funds that at some point aren't going to be there anymore. So, and we're one of the few crisis stabilization facilities left now. A bunch of them have closed, so we're one of the few. So with that, I do think that helped, because just getting the opportunity to be in front of them and talk to them, and now continually go in front of them and talk to them about different things, because that education on seeing all the programs that we do, I think that that's going to help us as we move forward with some other funding initiatives. So I think that there's more to do there that I will continue to do to work on. But as far as nursing home funding, unless Lance got a different viewpoint on that, I really don't think that they're going to bring anything forward.
No, you're challenging my perpetual optimism, Gary. I think it was a good meeting for all of the reasons you said. I think on the nursing home front, absent circumstances getting worse, I don't think there wasn't an appetite to bring something forward. Now, if the kind of that segment of our work at North Central or other counties have other concerns that come up, if the change in Medicaid reimbursement doesn't have as strong of a positive impact as I think people are hoping that it's going to have, there will be another opportunity to engage them. But on the nursing home supplemental side, I would agree with you. I didn't leave with a lot of confidence that, they're going to bring forward another bill and the bill is likely to get traction. I do think, like Gary referenced, on all the other areas, it was a good meeting. Gary walked them through Lakeside Recovery, the new medically monitored treatment program. A lot of very strong comments from individuals there about how this is a very much needed resource, how it fits in with our entire continuum of care on the campus. So good overall. We use that also, the meeting, as an opportunity to highlight the fact that with an inpatient hospital and the other continuum of care we have with the adult and youth crisis stabilization facilities, that challenging the legislature, the legislators that were there, that if there's ever any bill that relates to Winnebago Mental Health Hospital or Mendota, be thinking of us too, because we really operate in a very similar way. And I think that was, I didn't get the sense that they had thought of us that way before. So that was a positive.
That was, and the one thing I have to say too, when we go back to the nursing home, there wasn't the appetite to restore the funding, but we also spent a lot of the time talking about the current formula that they use that really doesn't work well for us. It benefits Rock and Dane County, but not us. And the fact that all the county nursing homes had voted, except for Rock and Dane, to change that methodology to be based upon Medicaid days and instead of the costs, because if it's on the costs, you can have a nursing home that just takes one Medicaid patient and they're paying exorbitant costs and they're getting all this money. And it really is for Medicaid. So that one, I do think that they listened to quite a bit on, that DHS needs to have pressure put on it, that they change that formula. So in that aspect, I think that was good, because going forward, that would really help us. So I don't want to portray that the meeting was it maybe didn't get the end results that we would have really liked. And I knew that was being too optimistic to get that, but I do think that it was a very good meeting. It set a lot of groundwork and will help us, and hopefully now we'll see here, we should be getting notice here any day now on the next year's supplemental. So hopefully that will gain traction. So that made it well worth it.
Thank you. I was that was like a roller coaster. I was disappointed at one point, and then I got excited, and I was back down. But
I saved the best for last. I'm sorry.
I really appreciate you guys taking the time to put that together, inviting those representatives to come see it. And it does sound like you said, it made some good headway in other areas that we weren't thinking of. So, are there other questions or comments? Supervisor Covelli?
Sure. Thank you, Gary and Lance, for doing that. And I know we talked at the earlier Health and Human Services Committee meeting that it's important to get that information in front of the representatives in Madison. Did they speak about anything about the next budget cycle and possibly bringing it back at some point?
No, they really didn't talk about next budget cycle with that, but it didn't seem like they were big on doing that. Now, if the supplemental stays at the 39.1 million where it's at, which there's a question on if that's going to stay there. But if that stays there and they change the methodology, going forward, we would be good. So that's a huge thing on that methodology, but I don't know how much, from talking to them, how much pressure they can put on DHS. But now that it's out there and that's understood, I think that's what we need to start pushing harder, is that aspect of it. So that's where I think we'll continue to push harder.
Sure, and I agree with you. As long as when that comes around again, if we get in front of them before they have to make any decisions, when they're setting the groundwork for that, I think that's important, even though you might not think it makes a difference at DHS, but I think it really does when you put that pressure on the representatives. A lot of feedback that I get, especially like from Corey and Donna and those folks, are that they don't hear enough of this stuff from the people where it matters. So as long as we get that information in front of them in a timely manner before they have to make that decision and keep that pressure on, something might happen. So thank you for that.
Are there any other questions or comments? All right, thank you for the update. We'll move on then to 7B, Marathon County Radon Mitigation Activities. We have the radon man here. I'll work on it.
There we go. Can you hear me now? Great. Okay, brief slides on what our radon program is like. And I have to start out by saying that Marathon County, along with Waukesha, back in the mid-'80s, was one of 2 counties that took on radon programming statewide. Marathon County took care of the top 2/3 of the state as a radon information center. Currently, there are 17 of them that got broken up, thankfully. We wouldn't want to have to take on all the counties in the, above the lower third. In Marathon County, we're Area 7 there, and we have 10 counties within our district. Funding is provided by the EPA, and we are a resource not only in Marathon County, but to the health departments and citizens in those other counties. Background on radon, if you're not familiar, it's a naturally occurring radioactive gas. It's a decay product of uranium, and we have plenty of granite here, which contains uranium. So it's not going away. Half-life is like 3.8 billion years. It's not going away. It's colorless, odorless, it's tasteless. We don't know how much is in our homes unless you do your test. High levels of radon over a long period of time is associated with lung cancer. It's considered the second leading cause of lung cancer following cigarette smoking. And it's in all building types. People who build brand new energy efficient homes and those of us who have old farmhouses that seem drafty at times. This is just a depiction of the radon map. I couldn't even tell you how many tests this represents by zip code, but you can see where we are planted there. We're in the over 50% of our test results come back elevated. And so it's something that's just part of our communities. Lastly, just describing our activities. It starts off with a lot of consultations, many times with residents about where to get radon kits. We sell them at our department, or you can pick them up at hardware stores. When to test, where to put the test kit, upstairs, downstairs, basement, where, how to interpret the results of a test, depending upon the season of the year, what kind of mitigation should be done to try to solve this problem, how fast do I need to work on it? And if I'm building a new house, how can I get ahead of this and save myself some money on the way? Many consultations with the homeowners, but also home sellers and buyers. Radon is one, I think it's item 15 on the home disclosure sheet, and it comes up at that time. And we work with realtors and contractors who are involved in the mitigation work. Radon really fits into the county's missions, goals. Healthiest and safest. We want indoor radon levels in Marathon County to be under 4 picocuries per liter. A picocurie per liter is a very, very low level of radiation exposure, but like lead, no level of radiation exposure is considered safe. Economic, I should say, we get a lot of people that get 4s, 5s, 6s. We've had as high as 400 in Marathon County, so it does vary quite a bit in our community. Economically prosperous, we don't want radon to be getting in the way of home sales, purchases, or construction. And really a big part of our mission is to promote testing and support informed decision making. I honestly tell people when buying and selling homes, if you're going to pick a reason to not follow through with the sale, let it not be radon. Make it the roof, the septic system, something big. Radon is fixable. Don't let it stop this. And we really do provide a lot of support to the other counties in our RIC, and I failed to mention the tribal communities that are in those counties as well. That was a rapid fire radon overview. And I have to share, I didn't think of this right away. I've been dealing with radon. I've been talking radon for 33 years. It was my introduction to public health back in La Crosse County. So radon is just old hat to me. But I'm open for questions if there are any.
Yeah, thank you. I forgot to mention before the presentation started that the reason this is on our agenda today is because another supervisor requested information about what Marathon County is doing, and that person is not here today, and I don't think anybody is online besides Supervisor Leahy. So I'm not sure what questions this person had. Okay. Perhaps maybe they'll think of them after they take a look at the presentation. But if anybody here today has questions for Dale, go ahead. No?
I'm done.
Well, thank you. Appreciate the information and the time you took to put that together.
Sure.
All right, so that brings us to number 8, next meeting date and time, announcements and future agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next meeting is Wednesday, January 3rd, 2024 at 3 p.m. Supervisor Krause.
Thank you. I have a request that maybe we could have a group that works with people with disabilities give a presentation. I know that in Marathon County there's children, teens, and many adults with disabilities. This is Mid-State Independent Living Centers, and they cover many counties from central Wisconsin up north. And they're advocates, and they help out with people who have disability concerns, whether it's tenant landlord, whether it's work situations or whatever. So I just think it would be nice to contact them. They're in Stevens Point. I can give you this brochure and maybe have them give a short presentation.
Yeah, if you can just give me the information, I can take a look at it. Thank you. Right, no other discussion then. I will take a motion to adjourn. Supervisor Gonering, second Supervisor Covelli. All those in favor, aye? Aye. Opposed? None opposed. We are adjourned. Thank you.
My son showed up at about 2:30, so I couldn't